I want to welcome everyone to this COVID-19 Healthcare Coalition webinar on counterfeit mitigation. My name is Taylor Wilkerson with MITRE Corporation, and I lead the coalition supply chain efforts. Today, we'll be discussing the scope and scale of counterfeit products in the COVID-19 supply chains, as well as mechanisms that are in place to reduce counterfeit risks. This is the first of 3 webinars we are presenting on counterfeit mitigation. The next will be December 2nd, and the third on December 17th. I want to quickly thank the team that has helped organize these webinars. Karen Conway of GHX, Carrie McCarthy of LMI, Fred Kranz of St. Ange, Greg Multhrop, Kevin Smith, and Shelley Pack of RFXL, and Susan Ginnivan and Beverly Wood of MITRE. This webinar is being recorded and will be posted on the coalition website, c19hcc.org. And we are going to save some time for questions from the attendees today. If you do have questions during the discussion, please post your questions in the chat, and we will pull questions out of the chat for that session. So I'm very happy to have John Strong of Access Strategy with us here today to moderate today's discussion. So with no further ado, I'll turn things over to John.
Well, thank you, Taylor. It's a pleasure to be here today. As Taylor mentioned, I'm John Strong. I'm a co-founder and chief consulting officer for Access Strategy Partners. It's a consulting firm based in Boston, and what we do is help small and mid-sized companies gain traction in what has become a very challenging healthcare environment in terms of introducing new and innovative technology in the marketplace. I spent the first half of my career in acute care organizations, second half running group purchasing organizations, including Premier for 7.5 years and Consorta for 10.5 years. I'd like to get us started this morning, and we're going to introduce the panelists one by one, and they each are going to speak a little bit to the topic today in terms of the prevalence of counterfeit PPE in the marketplace, and we'll probably get into some other areas as well in terms of counterfeit products. It's been a problem in healthcare for a long time, but certainly the pandemic has made it far more acute, and it's really raised the visibility of this issue in the marketplace. So without further ado, I'd like to introduce Rob Handfield. Rob is the Bank of America Distinguished Professor of Supply Chain Management at North Carolina State University. And he's also the director of the Supply Chain Resource Cooperative. Handfield is considered a thought leader in the field of supply chain management, and he's an industry expert in the field of strategic sourcing, supply chain intelligence, and supplier development. He's spoken on these subjects really across the globe, including China, Azerbaijan, Turkey, Latin America, India, Europe, Korea, and Japan, as well as Canada, in multiple presentations and webinars. Handfield has published more than 120 peer-reviewed articles in publications such as the Wall Street Journal, Bloomberg, NPR, the Financial Times, and the San Francisco Chronicle, as well as CNN. He's recently published an article on the shortage of PPE in the Harvard Business Review and also the Milbank Quarterly Review. So it's a great pleasure to welcome Rob this morning, and he has a presentation to sort of set the tone for some of our questions and discussion later today. Rob?
Great, thank you very much. It's a pleasure to join you here today and to be with this group. As I said, I'd like to kind of share some kind of insights that we developed on a study that we conducted on counterfeiting. And I'm going to kind of go through very quickly some of these insights. Can everyone see my screen okay at the moment?
Yes, we can see it, Rob.
Okay, great. So we conducted a study for the Center for Advanced Purchasing Studies on an overview of counterfeiting. And you know, as part of this study, we interviewed a lot of brand security experts. We also talked to a lot of people who had experienced counterfeiting. We went to, there's a group for anyone who's interested at Michigan State University called ACAP that really specializes in the study of counterfeiting. And they have an annual conference. This was pre-COVID that we attended. And we also spoke to a lot of people from the law enforcement branches that have worked in the counterfeiting area. And we have one of those today that we'll introduce to you later on the call. Just from a kind of a baseline perspective, it's important to understand what counterfeiting is and what it isn't. Counterfeiting are seen as trading goods that, whether due to their design, trademark, logo, or company name, bear without authorization a reference to a brand. Unfortunately, what we see is that the fines for these illegal trades, for this illicit trade, are very low. At most, they've been in the past sort of a slap on the wrist. And counterfeit products are not only highly profitable, but because the fines are so low, it's also low risk. And it is a little frightening when you start to think about the amount of illicit trade that is occurring on a counterfeit basis. And it's also very dangerous. It can lead to exposing people to counterfeit products. And during COVID, we saw counterfeiters. They're really not ethical people, and they were counterfeiting masks, medicines, a variety of healthcare items that were really putting our patients and healthcare workers at risk. The estimates of counterfeiting, and this is from OECD data, is rising rapidly. So in 2022, the total estimates of international trade in counterfeit pirated goods was close to $1 trillion. About 500 billion of that to 950 billion of that is consumed domestically. And that doesn't also include all of the piracy in music and software. The total volume of counterfeit and pirated goods is a staggering $2 to $3 trillion a year. And when people look at that number, it doesn't seem real. But yet, I think for the average person, counterfeiting is something that happens every day. You think, well, I'm going to buy this, and I don't really know if it's real or not, but I'm going to go ahead and buy it anyhow. And people think, well, there's no harm in that. Well, there actually is harm. It's actually a criminal activity, and you're helping to support that activity. In terms of the counterfeit goods that are seized at the U.S. border, there's a global counterfeit report every year. Homeland Security reports on that. We might hear more about that as well. And it tends to be the stuff that people don't really worry about. Watches, handbags, clothing. If you think about it, you can go to Canal Street in New York City and find all of these items, and they're all counterfeit pretty much. And a lot of the stuff that is seized, 90% of it is coming from China and Hong Kong. And China is really the counterfeiting capital of the world. And a lot of this is also coming across through e-commerce. And if China is the capital of counterfeiting, then Amazon is probably one of the biggest hubs for trade of counterfeit goods that comes across the border. So there's a huge amount of this which is occurring. It's also important to understand, the different types of counterfeiting that people get involved in. The first is what's called adulteration. So you're maybe a component of the final product is fraudulent, not the entire product, but it might be a component. So for instance, in finished products, a component on an airplane or on a vehicle, believe it or not, can be adulterated. Tampering is using a legitimate product and package in a fraudulent manner. A lot of the counterfeiting occurs when there's a legitimate product, but because it's been outsourced to China or Hong Kong or one of those countries, that factory that produces that product will produce in excess of the production agreements and will sell it through illicit channels. So it is a legitimate product, but it's being sold through illegitimate channels. In other cases, theft, especially in pharmaceuticals, You see trailer loads of material being stolen. A lot of opioids are being stolen and sold on the black market. And you're also seeing the same thing, which is diversion, which is during distribution of these legitimate products, they're being waylaid and sold outside of intended markets. And the danger there is, if there's an expiration date or an item isn't held at the right temperature control, it could be sold as a legitimate product, but may not be effective. And that's one of the reasons why we're seeing a huge amount of security around these distribution of vaccines next year. You see others that are designed to look like, but don't exactly copy the legitimate product. And then in a true counterfeit product is when all aspects of it are fully replicated, and you can see that it's not an actual product. There's different types of counterfeiting that occur also in channels. Gray market is really about looking all of the activities of production. You can remark or repackage the product. You can have a misrepresentation of their characteristics. Is it truly recycled? And you see this sometimes again in aircraft parts, where you'll have a component which is meant for recycling, but it's rebranded, cleaned up, and resold into the market as new. So you see that kind of activity, and then you also have sort of these other types of products that end up in channels that are very difficult to detect. And then, of course, you have the smuggled and stolen products. What we found in our study, and we'll go through this very quickly, is there really isn't a single tool that you can use for counterfeiting. We discovered that to really be effective, you have to establish a process within your organization that is focused on this, and it has to be something that really crosses all of your business functions, because there isn't a single function that's responsible. If you just leave it up to brand security, you're not going to be effective. You need to include procurement, you need to include marketing, you need to include operations, your distribution function, your legal function, your brand security, and that council then needs to define the problem. So how big a problem is it? What are some of the key metrics that we should gauge to measure the success of whether we're really attacking it? Conducting assessments of that activity, continuing to monitor and collect data, and then start to figure out, well, who do we work with, and who do we collaborate with? Or are there parts of our supply chain where we're seeing that counterfeiting activity largely focused on it? Is it in distribution? Is it in our sourcing channels? Is it in our partner distribution or our licensing? And then technology is certainly a part of it, and there's some excellent track and trace, anti-counterfeiting types of labels. The problem with labels is, guess what? They can be counterfeited, right? So counterfeiters, we find, are very clever, and if there is a special label or technology, they can find a way to replicate it, and so that isn't a single solution. Another really important activity is to collaborate with law enforcement, and law enforcement is really a countermeasure. They can be partners in your battle against counterfeiting, especially when you're dealing with central points such as the IPR Center, who will be on the call today. And then finally, we need to work with our suppliers to reward compliance, to find trusted partners in our supply chain that we know are not going to be counterfeiting or benefiting at our expense. And so it is an endless battle. I don't think that you will ever get to a point where you eliminate counterfeiting completely from your supply chain. I think one of the best quotes someone said is, if you don't think your product is being counterfeited, guess again. It just means you aren't aware of it. The chances are, if you have a product which is fairly profitable, it's in a fairly high volume, somewhere it's likely being counterfeited. And if you don't believe that, then you're being naive. As I said earlier, I think we have to think about all of the parties in our supply chain. When we look at just pharmaceutical medicines, for instance, there are numerous middlemen. We talk about GPOs, there are wholesalers, there are retail distributors, and then there are often third-party manufacturers, third-party distributors. There are multiple opportunities anytime there's a handoff to be able to identify potential counterfeiting that's going on in your supply chain. So it does require, in some cases, looking at your end-to-end supply chain and really trying to figure out where that activity is going. A good place to start is just to define the size of the problem, and looking through your sales data, identifying what's going on. Also, if there's a feedback loop, if looking at your returns is an important issue. When you see customers returning an item, and you look at the item and you say, hey, this isn't our product, this is not even something that we made, that is a clue that there's something going on there. You may want to pull on that thread, unravel it, and try to figure out where that product came from. And chances are you're going to find more of that activity going on. A great example here was a apparel brand discovered that they had items that were being sold in Mexico from their apparel brand, and they didn't even distribute in Mexico. And they followed the trail, and they found that the items were being brought in through a port in South America. And they followed the bills of lading, and they traced it back to their own contract manufacturer in China, who in fact was overproducing and selling it through unauthorized channels. So there are, these are clues that you can start to unwind and start to figure out. And I think the goal here is, is it really likely that we're going to get to 0%? It may be difficult if you're doing that. But I think you can cut down the size of the problem, and you can make it more difficult for counterfeiting. And the last question there is, what's the cost of doing nothing about counterfeiting? And I think that's an important question to ask yourself. So this is a very, very kind of high level overview. There's more material that we can provide to you, which is available in our in the CAPS report, which I think is made available to everyone on this call if you're interested. But right now I'd like to open it up to kind of an ongoing discussion with some of the other people on the call, because I think there's a really interesting set of questions that we can talk about here.
Rob, thanks. That's a terrific overview of the problem and the size of the problem, the scope that we're dealing with here. Next up, I'd like to introduce our second panelist, Brian Weinhaus, who is currently the unit chief at the Homeland Security Investigations-led National Intellectual Property Rights Coordination Center, or the IPRC, where he oversees the intellectual property and intelligence sections of that unit. His unit provides leads, oversights, expertise on all national intellectual property issues, including investigative operations, which include sectors such as automotive and heavy industry, pharmaceuticals, health and beauty products, consumer electronics, clothing and sports merchandise, digital piracy, tobacco, government and DoD, supply chain security. Brian comes to IPRC with over 25 years of law enforcement experience, with previous positions within HSI to include group supervisor, operations manager, special response team tactical supervisor, program manager, and criminal investigator. We're pleased to have Brian with us today, and he's going to share a bit of his view of how his agency functions and their role in trying to coordinate response to some of these problems. Brian, how are you?
Thank you, John. Very good. Thank you, John. I appreciate the introduction. I'm going to share my PowerPoint here. Just by way of introduction, as Rob said, I'm a Homeland Security Investigations Special Agent. My current position is Unit Chief at the Intellectual Property Rights Coordination Center. And just to give a little brief overview of who and what that is, I've got just a few slides to cover. So Homeland Security Investigations is the principal investigative arm of the Department of Homeland Security. We have over 7,000 special agents assigned in 210 cities across the United States and in 53 foreign countries. We have the statutory authority to investigate and enforce over 400 federal laws. Within HSI is the National Intellectual Property Rights Coordination Center, or IPR Center is what we call it, where we coordinate investigations of trade fraud and intellectual property violations with the mission to ensure national security by protecting health and safety of the public, the economy, and our warfighters. We attack vulnerabilities in the global supply chain to further secure the border, facilitate legitimate trade, and dismantle criminal organizations engaged in trade crimes. The IPR Center has 25 agency partners to include 5 international partners, which are Europol, Interpol, the Royal Canadian Mounted Police, City of London Police, and the Mexican Revenue Service. So the IPR Center stands at the forefront of the U.S. government's response to combating global intellectual property theft and enforcement of its international trade laws. And we serve as the primary government investigative entity for exchange of information and intelligence related to COVID-19 illicit criminal activity. During the pandemic, we learned that transnational criminal organizations around the world were actively seeking to exploit and profit from a wide range of criminal activity. Individuals and organizations quickly adapted when these opportunities presented themselves, and so we had to adapt quickly as well. In April, HSI launched Operation Stolen Promise to combat these increasing and evolving threats. The operation combines HSI's expertise in global trade investigations, financial fraud, and cyber investigations, along with our public and private partnerships, all with the intent to disrupt and dismantle this criminal activity and strengthen global supply chain security. Besides the obvious IPR infringement that we were seeing, we all understood that COVID-19 related crimes are financial in nature, as monetary gain is the primary purpose of the efforts. And the majority of these frauds also were being perpetrated over the internet. So as part of Operation Stolen Promise, we ensured that we included our illicit finance and proceeds of crime unit and our cybercrime center. The illicit finance and proceeds of crime unit is the principal arm of HSI dealing with financial fraud investigations, and cybercrime center, or C3, is our division dealing with cyber technology and frauds. It also cannot be understated the importance of HSI's partnership with Customs and Border Protection, or CBP, and their efforts at CBP's National Targeting Center. CBP is the agency who's responsible for the entry of goods and people into the commerce of the United States. They are the organization that tracks and interdicts violative shipments of goods and people at our ports of entry. The National Targeting Center, the CBP-led collaborative effort, including other agencies like HSI, that work on targeting and intelligence on imports, exports, of people into the United States. Our investigative efforts at the IPR Center and CBP's National Targeting Center focus on developing actionable leads and intelligence leads to be given to the field. The data that the NTC, or National Targeting Center, enables the targeting of suspect shipments and packages to be placed in front of CBP officers at the ports of entry, or who are responsible for inspecting the massive amounts of parcels and cargo that arrive daily in the U.S. We're also working daily with representatives from key industries to obtain current authentication techniques and share real-time trends that are being observed with CBP to aid them in the targeting of shipments they see at the border. This is a quick infographics. Yeah, sorry.
Brian, this is Taylor. I just want to quickly, sorry to interrupt, but your slides are not showing through the Zoom. So
oh, weird.
Sharing your screen again, or if you want me to show them, I can as well.
Yeah, if you want to pull it up then. Yep, I'll wait for you. Can you just go to slide 5? I won't repeat everything. Wasn't that? One more. Sorry about that glitch, everyone. Zoom doesn't work super well with Go back one, please. Doesn't work super well with government computers. They have them locked down. Yeah, perfect. So this is our Operation Stolen Promise infographic, and this just gives a snapshot of our progress to date with COVID-related frauds and schemes. Just very, very briefly, you can see on there we've had, in conjunction with CBP, over 1,500 COVID-19 related seizures, and that's seizure events, not seizures of items. So it's infinitely higher the number of items that were seized. We've analyzed over 66,000 domains. We've seized over $12 million in illicit proceeds. We've gotten back $6 million in CARE Act fraud. We've disrupted and recovered funds up to $18 million. We've sent 1,400 investigative leads to domestic and international offices. We've had 130 search warrants and 137 criminal arrests. Next slide, please. So this is our infographic on our public awareness campaign, and the purpose of it is to promote the initiative and increase awareness of our role in combating this criminal activity. The public awareness material includes red flags, tips, and facts related to fraud online in the financial sector and in commerce, as well as details on where and how to report potential fraud. Next. These next 3 slides, I'm not going to go into detail about, but hopefully, especially because you didn't see the beginning of my slideshow, but these slides will be made available to you, hopefully, and just give you additional tools on being able to seek out counterfeit versus approved PPE and other additional things. So you can just skip the next 2, just sort of slide through them. And last one is just my contact information. I'm always available to chat, answer any questions I can. So thank you, and I apologize once again for my slideshow not showing up.
Well, thanks very much, Brian. Very informative, and it's good to see that there's a number of enforcement activities going on in the United States. I think COVID has sort of overwhelmed us all, and particularly in the PPE area, and it's good to see that that's going on. Our final panelist, last but not least, is Sarah Baker. For the last 5 years, Sarah's been the program director at Healthcare Ready. Prior to that, she was a senior analyst at Obsidian Analytics for 3 years. And she holds a master's degree in public policy from Georgetown and a BA from Notre Dame. She's going to spend just a few minutes talking with us about the role of Healthcare Ready in the marketplace. So Sarah, if you'd like to go ahead.
Absolutely. Sounds good. Thanks for the introduction, John. And thanks to MITRE and the team here for inviting us to be on. I'm going to go ahead and share just a few slides, a quick overview of kind of who Healthcare Ready is and where we operate in this space. So give me just 1 minute as I pull up my slides. This went so well during the practice. All right, hopefully everyone can see my slides now.
We can see them.
Great. So I just want to spend a few minutes giving an overview of who Healthcare Ready is, like I said, and where we operate in this space. For those unfamiliar with the organization, Healthcare Ready is we're a national nonprofit and also an ISAC, or a designated information sharing and analysis center for the healthcare and public health sector. And our organization was founded after Hurricane Katrina by the trade associations making up the healthcare supply chain to really serve as the central coordination point between private sector healthcare supply chain components and healthcare facilities and public sector emergency management agencies, public health departments, law enforcement. So we really sit at that intersection of private sector healthcare and public sector emergency response. And as the slide suggests here, our mission and what we were founded to do is to really strengthen supply chain operations through public-private coordination, public-private partnerships. So we work closely with both sides and try and translate requests for information, requests for assistance, but also educating on both sides kind of where some of the concerns and challenges are and what the impacts of different actions on either side could be. And so we are, part disaster response organization, part preparedness and resilience organization. So we have been activated for almost this entire calendar year. I think like a lot of folks on the line have been. And this is just a quick slide of kind of what we do when we're activated, helping to make sure healthcare deliveries get where they need to be, making sure those public sector partners are tuned in and connected to private sector partners, and building those relationships in advance or before an event. So we try and host a lot of convenings, do a lot of introductions, opportunities like this to share more about our organization and how we can help strengthen some of those partnerships. And this is a quick slide kind of on what we've been doing for COVID-19, specifically for the supply chain. So we're a fairly unique organization in that we're a disaster response organization, but not boots on the ground like many other national nonprofits. We really do kind of sit back in that coordinating space, learning supply chain concerns and challenges, understanding where there might be potential shortages or gaps, and trying to address those concerns before they become too acute. And so kind of what I'll be speaking to today is where we've sat in kind of our role in this this supply and donation coordination. So making sure that these urgent supply needs that healthcare facilities have, that community organizations have, that they're receiving vetted materials, vetted PPE, and what some of the challenges we've seen there are. So again, kind of our space, we've been coordinating different conference calls between pharmaceutical as well as med-surg supply chain components, and really helping to share requests for information on both sides to try and get kind of an aggregated picture of where the concerns are and what the challenges are within manufacturing, within distribution, within last mile. So won't read through all this slide. It just kind of underscores where we've sat during COVID-19 and how we've helped bring some different supply chain partners together and connect them with federal government partners when needed. And within this, this PPE and supply and pharmaceutical supply space, like I think many on the webinar today, we've received countless emails, countless offers from both legitimate and illegitimate PPE providers. And so kind of as one of those coordinating bodies, we've helped learn what some of these, what some of the warning signs are for PPE providers and pharmaceutical providers. And we actually partnered with BIO, the Biotechnology Innovation Organization, on managing the PPE requests and the PPE posts on their coronavirus hub. So they're one of several organizations that stood up these exchanges or hubs, almost kind of a Craigslist of sorts of PPE needs and supplies. And so we partnered with BIO and kind of in that capacity, really started to get in the weeds of what some of these, illegitimate offers could look like, what some of, just how aggressive brokers can be, and what that looks like in terms of kind of how they connect with smaller healthcare facilities as well. I think that was a role that we played and continue to play, is helping connect some of these smaller healthcare facilities who maybe don't have the purchasing power of larger hospital systems or health systems, who don't have the same resources to vet supplies, helping to connect them with organizations and resources that can help them do that. Also worked closely with FEMA and their donations management team, and helping to vet and advise on health and medical offers. So if these are legitimate offers coming in and being made to FEMA, and if they are, how to get them to the healthcare facilities and the partners that need them the most. And another effort, just wanted to flag, working with the National Governors Association, they stood up a kind of an ad hoc PPE vetting working group. And I know a number of folks on the line here are also a member of that group. And, we recognize that a lot of organizations in this space were spending all this time, resource, and energy, vetting these, non-traditional PPE suppliers or, folks who are just coming on the scene. And is there an opportunity to kind of streamline what the criteria we were using for vetting those non-traditional suppliers? So it's a really great group, including Project N95, American Hospital Association, ARM, their group, and a number of other partners, and really tried to kind of coalesce around what some shared vetting practices could be. So that group continues to meet on kind of an ad hoc fashion, and we've been a member of that group as well. And this is, I think most folks hopefully know how to reach us. We're at alerts@healthcareready.org, and happy to share my contact information after this as well, but did want to just lay the scene of kind of who we are and how we operate in this space, recognizing that, you're not quite in the public sector side, but not quite in the private sector side either, really filling that gap in that coordination role.
Well, thanks very much, Sarah. Interesting to learn more about Supply Ready. And I appreciate all of the panelists' opening comments. We're going to spend about 20 minutes talking with the panelists a little bit about some questions that we have internally about their presentations today and the whole scope of this problem. And then we're going to throw this open for questions from you all, the audience. If you'd like to ask us a question, simply put it in the chat box at the bottom of the Zoom panel. And while we're discussing these things, if things come to mind, put it in there, and then Taylor is going to be vetting those out and sorting them while we're discussing a few things. So what I'd like to do is turn to this whole notion of, we've heard from Rob and we've heard from Brian and Sarah on this whole notion of the scope of this problem, particularly with PPE in the last 9 months. And I'd like to turn to Sarah first. I was looking at a website for 3M Company, and as you know, 3M has been pretty vigilant in trying to preserve their brand name and their reputation for respirator masks and other things. And they said on their website yesterday that they've removed more than 14,000 deceptive email posts and more than 12,000 sort of counterfeit email offerings for their products so far. Can you talk just a little bit about the true scope of this? We've read in the Wall Street Journal that more than 1,200 or 1,300 Chinese companies registered in the United States for approval of their products, and it turned out to be a bungalow in Wilmington, Delaware, I think, where a retired couple was living. And so how do we get our arms around that? And is this just the tip of the iceberg, Sarah? And then I'd like the other panelists to join in with us.
Sure, absolutely. And an important question, especially as we're entering the winter phase of this pandemic, and we see case counts soaring, and hospitals overwhelmed or at capacity. I think we have a lot of lessons learned for how to vet these suppliers and understand the scope of the issue that we learned at the beginning of the pandemic. I can't tell you how many emails and calls we received from certified 3M vendors when those didn't exist, or they could show us their letter later, but first wanted to get on a call with us. So I think it was almost an insurmountable problem in the beginning, but we do have a lot of lessons learned. And I think, calls like this, some of these ad hoc working groups that have stood up have been an excellent effort to kind of get our hands around it and learn what it looks like going into the winter. I think you're on mute, John.
Yeah, sorry. Rob, what do you have to say about it?
Yeah, so I've been working with the Joint Acquisition Task Force since March, and we were working on helping to identify sources of PPE, and also we've been interviewing state procurement officers through the National Association of State Procurement Officers, and what we found was that there was indeed a plethora of counterfeit masks that were going out. Some of the masks were claiming to be 3M masks. They had the label on them, and very often, the label there was a misprint, or it was written the wrong way, or what have you. And so, sort of a best practice was to really be able to vet those suppliers before you bought them, and you vet them, and you actually ask for a sample. And if they don't send you a sample, then you know right away, well, they're not for real. And then sometimes you get the sample, and you need to have a professional industrial specialist who can look at it and determine whether it's truly a NIOSH approved mask. And in many cases they weren't. The fabric itself was not the N95 fabric that allowed particles to go through at a different rate, or the labeling was off, or there were so many different variations of these masks that people were claiming were real. And the sad thing is, some of these masks, some of the vendors almost all of them required some form of down payment up front. So state procurement officers would go out and make exceptions to their procurement laws. State procurement doesn't allow that, and then put money out there, and then they were counterfeit, or didn't show up at all. So there were a ton of scammers, and I'm sure Brian has a lot of stories of those as well. But generally, I would say ask for a sample, vet the supplier, check on their financial background, where are they located, do your due diligence before you go ahead and buy from them.
Brian, can you speak to that just a little bit? Rob had some important points there. Also, in terms of, are there some products that are more compromised than others? We've seen the whole issue with respirator masks really since the beginning of the pandemic, but are there some other products as well that have been problematic that you can single out and identify for folks?
Yeah, I would say that the scale and scope is difficult to determine. I mean, when COVID first reared up, the entire government basically moved to a posture of trying to deal with it. And the frauds that we've seen have changed and adapted over time. So we continually have to adapt as well. In the beginning, the biggest problem we saw were with unapproved testing kits that were coming in. And that's not particularly an intellectual property violation. It was more a violation of the Food and Drug Administration's rules on what was approved and not approved. And it took some time to clear that out. And then in the internet or social media or on the news, things are mentioned and the fraud changes. So we had a period of time in which hydroxychloroquine was coming in through illicit means. So like to unapproved individuals, people who were not allowed to distribute it themselves, the hydroxychloroquine coming in was in powdered form and then made into tablets here in the US. So that was an issue. And most recently, what we've been seeing is a move towards, like you said, the PPE, where the needs are. So 3M has gotten hit hard with people counterfeiting their masks, but they're taking a strong stance. We're working very close with them. We have many cases where we've seized masks in bulk that were violative of their patent trademark. So that's really good. And I would say I don't work in supply chain myself, but to me, what we do is we work very closely hand in hand with the manufacturers themselves. And that's how we determine whether or not things are legitimate or illegitimate. And the work just couldn't be done without those partnerships with the private sector for us.
Are there some other suppliers that come to mind besides 3M that have been working really closely with you in terms of trying to eliminate counterfeit products that you can talk about?
Yeah, I mean the entire fashion industry, they're having a lot of their trademarks put on fake cloth masks. So we've been working closely with them, and now we're moving towards trying to get ahead of a potential wave of fraud having to deal with vaccines. So we're working very closely with Pfizer, Merck, Johnson & Johnson, Eli Lilly, trying to get ahead of the game so that we're not playing catch up at the end. I would say, it's really across the board, but that would be the fashion industry was one, 3M, and then now dealing with the pharma industries.
Good, thanks much. Rob brought up an interesting point early on about the fact that some of these suppliers asked for large payments up front, either 50% or 100% down before they would ship product. And in many cases, they represented their product on pictures only. And in fact, there's been rumors that a few people have gotten swindled out of multi-million dollars worth of deposits on PPE. Yeah, when this type of activity happens, is there somebody that the three of you can recommend that you call besides your congressman and ask for more government intervention of these types of problems? And is it a good idea? I know some people have come up with plans now where they just won't pay anything up front any longer for PPE, but you know, desperation is made for an interesting market.
Yeah, I
Yeah.
could, you know, briefly, I would say, you know, get a sample. Like I said, it's really important to get a sample. You know, the FDA has a list of approved manufacturers that have masks. You can go on that list and you can find them. You know, I would say there's other, you know, other universities, for instance, have testing centers where they can look at a mask and test it for you. You know, University of Minnesota is one. There's a few others as well. Or, you know, there are resources, you know, professionals that can you know, test those samples as well. You know, industrial hygienists that are specialists in this area, and you can find those folks. So I would say, you know, that testing piece is important. During COVID, you know, that many people had to pay that upfront cost, and many states paid it, and then paid upon, you know, 50% upfront and 50% when it was shipped. And even in some cases, we saw where some of them were putting the 50% upfront, and if they didn't act quickly enough, that shipment would be gone. And in other cases, sometimes the shipment would arrive at a port, and you know, there was an article in the Wall Street Journal, and that shipment was confiscated by the national stockpile and put into storage. So there was it was really the Wild West in terms of what was going on out there, and it was states battling other states for PPE, and that kind of situation led to desperation. And you know, I think we need a much more centralized, disciplined approach to managing some of these supplies going forward. More of a centralized approach.
Ryan, Sarah, your thoughts on this?
Yeah, I was just going to say, I would suggest people that are defrauded, or organizations or governments that are defrauded. There is under the Department of Justice, under the U.S. Attorney's Office, there's the Consumer Protection Branch, and they're basically working full time on dealing with just exactly these types of fraud. And in order to get in contact with them, it's reaching out to whatever HSI or FBI office is local to you to pass on the information. And then we pretty much work as a team in order to conduct investigations of these types of frauds.
Sarah?
Yeah, and I would just add, yeah, there's the, you know, one side of reporting those frauds and working with government to, you know, kind of quote, catch the bad actors. I think, you know, there have been efforts to, you know, provide more centralized lists and resources to the good actors, or some of those alternative suppliers who did become vetted, who did truly enter the space in the right way. And I know the American Hospital Association, Project N95, GovShop, and others, you know, collaborated to, you know, indicate, hey, this supplier is vetted by Project N95, GovShop, and the American Hospital Association. So there's kind of that redundancy of, okay, it's not just one person who's vetted them or one organization, but there's, you know, kind of these places to go where you can see who else has vetted them, who else has used them before, and at least start from there.
Okay, good. One of the things that the federal government and many state governments has been doing really for more than the last 10 years is stockpiling product, particularly certain PPE, masks and gowns and other things. Can the three of you talk a little bit about whether this is a good idea or not, and whether or not there are solutions other than stockpiles? It's not to say that stockpiles are bad for immediate response, but What are some of the other solutions as well? What do you need to do to manage stockpiles, and then what other solutions are available out there for states and providers that need pretty much instant access to product?
I can speak to that briefly, John. So we published a paper recently in the Millbank Quarterly Journal that talked about what we need to really start to rebuild the SNS 2.0, we call it. What does that national stockpile and response need to look like? And I think one of the things you think about with stockpiles is you have to have a way to think about how do you turn the inventory. Part of the problem with the SNS is that they had masks. They had them left over from H1N1, but by January, almost 50% of their inventory had expired. I mean, the elastic bands were snapping on these masks, and as a result, they were doing bulk buys, which is volume discount, large buys. But by January, that supply of masks had dried up. The export controls had gone up in China, and there were none to be had. So that was a really difficult situation. So I would say, some of the things we proposed as a best practice for a stockpile is keeping a record of your inventory and your expiration dates on that material. When does it expire? When is it going to be used? Turning that inventory, so making sure that it's used on a more regular basis. And then, stockpiles are good if you have the right stuff in stock, but you may not know what is needed. So you also need to monitor what's happening in your environment. And, are there new medical threats on the horizon? And how do you plan ahead to try to figure out what you might need at some point in time? And I think the thing that's most important is you need to have an emergency response function with a playbook. And by a playbook, I mean you need to document what are the activities you need to conduct, and you need to have the right people on that committee. And when I say the right people, at a federal level, I would suggest having FEMA, CDC, DHS, NIOSH, BARDA, having all the people that know what's going on in the world, and working together to create that kind of a format for brainstorming about what we need to be prepared for in the future. So I think preparedness is more than just about stockpiling material. It's about getting the right material in that stockpile and planning ahead of what we think we might need.
Okay.
Yeah, I would just add, to add to that, I think there's, the due diligence piece is incredibly important. And as Rob was alluding to, the forecasting of that, it's easy enough to say, we'll just, increase the stockpiles, have more stockpiled ready to go. But there's been a lot of work, and it's a hard space to, forecast what that looks like. What is 60 days supply for a hospital, in steady state versus, ramping up to a pandemic? What are those burn rates? It's an incredibly complex exercise to determine what that looks like. And I think it's also important, to really think through what stockpiling looks like. So, for most hospitals to keep 30, 60 days supply of PPE, it's, there are statistics everywhere. It's a football field's worth or 2 football fields worth. So it isn't as easy as just kind of, mandating that you just keep extra on hand.
Right.
As Rob was saying, the shelf life of these things is important to track too. I know the FDA has the shelf life extension program, things like that to look into. But I know the SNS 2.0 is examining all these issues very carefully and doing that cost benefit analysis and the pros and cons. And it's definitely a complex area.
Okay, great. Well, that's sort of a segue into another question I had. Some of the national GPOs are taking what I would call rather drastic steps to re-onshore the production of certain product. Premier, for example, has done this twice now. They and about a dozen of their owners bought shares of a privately held company called Ameritech, which is a large respiratory manufacturer here in the United States. And just this week, they announced also a deal for isolation gowns with 24 of their members with De Royal Industries. Is that going to help solve this problem, or does it make things more complex over time?
Yeah, I can speak to that. we've done some analysis of, onshoring, whether it makes sense. I think having onshoring makes sense if there are, in fact, government contracts that will guarantee, those, that there will be markets for those items. Part of the problem I see is, when we had the H1N1, I actually wrote a study in 2010 that talked about how we need to be prepared for the next pandemic, which, maybe people didn't read that, but, it sort of died down. And then all of a sudden people thought, well, it won't happen again for a long time, so we can go back to outsourcing stuff from low-cost countries and not worry. If we bring these domestic manufacturers on board, what will that look like, and what will be the requirements, and is there a long-term demand for that? So having, I think, the right contracts in place and the right incentives to domesticate, some of that production can certainly deal with the counterfeit issue, but it's also an issue of is it sustainable, and is there going to be a market for it over the longer term?
Yep, I was going to speak to that sustainability piece and the incentivization, but would also add that, this idea that domestic manufacturing is, automatically safer, more secure is, not necessarily proven out. I think that we do have incredibly strong vetting for the products coming in from our global supply chain. So kind of similar to stockpiling, domestic manufacturing and domestic production is a piece of the puzzle, but not, not the be all end all, the savior that we would hope that it could be.
Okay. One or two quick wrap up questions, and then Brian, you have some comments on that?
I was just going to say, like, from a law enforcement, from a customs point of view, it makes the identification and targeting of violative products a lot easier if they're produced in the United States. Just as an example, many of these pharmaceutical companies that are working on their vaccines, those that are going to be distributing in the United States, that product is being made in the United States. And things that are going to be used overseas are being produced overseas. So that makes it a lot easier for us as a customs organization. If we see, for example, some sort of what's claimed to be a vaccine coming in through the ports of entry, you sort of automatically know that it's not real. So it makes that, for us, the identification and interdiction quite a bit easier if things are produced in the United States that are going to be used here.
So to that point, Brian, are there some other groups? I know you've been working at the state level and with various healthcare organizations and others. Would there be a helpful coalition of folks like the group purchasing organizations in healthcare, or a group of large integrated delivery networks that could be helpful in working with your agency to try to identify these things up front?
Yeah, absolutely. We often work with organizations that of like-minded businesses that group together, and it really works well. We do it quite just as an example, in the automotive world, we work with a group called A2C2. It's like Automotive Association, something or other, but it's basically all the large automotive companies that come together to share information with us. It just makes that a lot easier than us having to have individual relationships across the board. If there's one organization that we can go to, I think it gives the businesses more power, but it also makes it easier for us for communication purposes.
And if I could just add to that really quickly, I think there are some of those coordination mechanisms that exist. So there are ISACs, information sharing and analysis centers, for each of the critical infrastructure sectors. There's also the sector coordinating councils for each of those. So within the healthcare and public health sector, there is the sector coordinating council that is that group of private sector representatives for the healthcare sector. Their counterpart who they work closely with is the government coordinating council. So folks at DHS, ASPR on that side. So some of those partnership structures are in place, and COVID has been, a really great opportunity for strengthening those, expanding those, and really demonstrating their value.
Yeah, another thing I would add is, I think one of the best practices we saw is, is when, if you are a domestic manufacturer or you're a manufacturer of PPE or any other product that could likely be counterfeited, register your brand, register it with Underwriters Lab, get it tested, get it registered, and then make sure that you contact the IPR center as well as Customs and Border Patrol. And if they don't know, that what your brand is and what your trademark looks like, when they do inspections, they won't know that it's counterfeit or not. But if they have it registered, they can at least check it and they can catch it before it enters the country. One of the things we saw is in April, there was a flood of PPE that came over to the US and which was inspected by Customs and Border Patrol. And they rejected a lot of it. A lot of it was counterfeit that came over during the April timeframe.
Great. Well, thank you all for this section of the presentation. What we're going to do next is there's been a lot of activity in the chat box, and Taylor has been editing some of the questions and some of the chat that's been going out there. So I'm going to turn it back to him and see if we've got some questions for the panel.
Sure, thanks, John. One that came up early on is you could talk a little bit about specifically around medical counterfeiting. What have you seen as sort of the most common medical devices or pharmaceuticals that you find counterfeited, and has that changed with COVID-19 in terms of what you see most frequently?
So if I can go, what we've been seeing so far in the seizure sort of as I mentioned before, in the beginning, it was a lot of the testing kits that weren't necessarily counterfeit, but were unapproved. It moved on to things that we were seeing in the news, like hydroxychloroquine coming in that was unapproved. It's been moving on towards face masks and other things of that nature. Did I answer that fully? Sorry.
Yeah, I would just add the most common we've seen as well is the N95s, specifically the 3M N95s that a lot of vetted or certified vendors came out with when that wasn't truth. And in fact, I think we've also seen KN95s also being misrepresented and counterfeit as well. So masks and testing kits have been the big ones that we've seen as well.
Well, and I think one of the things that I might add is, and I don't want to conflate pharmaceuticals with the PPE and the rest of the medical device supply chain, but for years people have been talking about the degree of problem with imported pharmaceuticals and the fact that the rate of counterfeit product swirling around in the United States could be 10% or higher. Does anybody have any thoughts on that? Is that low? Is that high? I mean, it seems to extend to all areas of healthcare.
No, I can add to that. Yeah, we work with there's another group called 360RX that I've worked with, and they work with a lot of the pharmaceutical companies, and they share a lot of best practices around which medicines they're seeing, and I think it's important to build that kind of an industry community, and to share what you're picking up on and what you're seeing. I know during COVID, there were a lot of medicines that suddenly became in very short supply, like the Flonase, albuterol, propofol that was used with the ventilators. And all of a sudden you started to see counterfeits of those products that were in dire demand starting to pop up. And that's what counterfeiters do. I mean, they pick up on what is in short supply and they replicate it, and they know people will pay anything to get this stuff if they have to, and they can charge exorbitant prices and get payment up front and get away with it. So.
Yeah, the only piece I would add to that is, commonly seeing opioids and other controlled substances trying to be counterfeited. And, there was a need for them, with ventilator and ventilator meds, but also seeing, people don't have access to healthcare in the same way that they maybe did pre-pandemic. It's the ability to always frequent a methadone clinic or those spaces. So like Rob was saying, we see these counterfeiters, picking up on those demand signals and those indicators and trying to exploit those. But opioids would be the other one that we would mention.
Okay, great. Taylor, another question for the group?
Sure. So I've had a couple questions around the international aspects of this. One specifically of to Brian of what agreements there might be internationally or with other countries on anti-counterfeiting that might make certain countries' sources of supply less risky than others, but also around inspections of facilities overseas and general question of what do you do if you don't have the resources to inspect the buyer's facility or the seller's facilities overseas? So maybe Brian, starting off with you on what agreements might be in place to help with counterfeiting internationally.
Yeah, so I think most like intellectual property things are covered in trade agreements. I'm not privy to all of those, but I believe when we enter into trade agreements with other countries, IP enforcement or duties are part of that. I also know like the Department of Commerce, I believe, keeps a list of countries that are most violative. So I suspect you could probably look on that. We just as an agency, I mean, we see it come from everywhere, but most of the frauds or counterfeits that we see coming through China, India, Hong Kong, places of that nature. But that's difficult because that's where most things are produced anyway. So that's not how we decide what we're going to target or interdict from the location. That's just a portion of how we try to figure things out.
Yeah, I know when we did our study, we found that, international collaboration is there. You have to, the State Department, the FBI, can help out with that. Interpol is an international agency that does share information. And, if you know that the counterfeiting is happening in a particular country, in some cases, other than China, you can work with the national, these agencies can work with that national government and share information and conduct raids. So, it does require collaboration between countries. Counterfeiting is a international problem. Every country is impacted by it. Some of the countries that are the worst hit with counterfeiters actually are Africa, where some of the medicines in Africa are 90% of them are counterfeit. It's awful. The level that you're seeing where there isn't as much due diligence that occurs. So it's a global problem, and we need global solutions, and we need to be working with our international partners to stop it from spreading.
Good. Another
Just have
question.
a really quick follow on if I could. So we have 53 different attaché offices, but combined with our partnerships at the IPR Center, I believe it's somewhere in the 80s of having representations overseas. And what we do, we have our attachés work with local law enforcement when we send them leads to try to deal with these issues. And a lot of times we see the businesses connecting up with local law enforcement as well, and we can help facilitate those connections. I just wanted to follow on what Robert said.
All right, there's another one sort of looking a little bit towards the future as effective vaccine starts to materialize. How would you recommend state procurement and or supply chain officers posture their organizations to minimize risk exposure from purchasing counterfeited or ineffective products?
Well, I think there are going to be some legitimate channels that the products, the virus and vaccines will flow through, and I think the security around those channels will be will be very high. So I think McKesson is going to be sending a lot of the kits. The actual vaccines will travel in temperature controlled trucks with temperature controlled boxes, and will be under a lot of security in transport. Once it arrives at the state, I think states need to start maybe working with National Guard and other agencies to ensure that the vaccines are protected, they are secure, And even for distribution around different parts of the state, different counties, there needs to be security protocol in place. I'm a little worried, to be honest. I'm not sure how all that's going to happen. I know there's plans in place, but I think every state needs to have that plan and needs to have a distribution plan around those vaccines. I wouldn't be going outside of those secure channels, despite what you hear that, oh, we have some extra vaccine available, that comes through on the fax or the email. Stay away from those sources, and I think that's the risk, and that's how items, leak into the supply chain, as people say, oh, I can get it for half the price, and I can get it from, this manufacturer in Canada. Well, that's a red flag. Stay away from those kinds of offers. If it's too good to be true, then it likely is not true.
Yeah, I just wanted to double down on Rob's comments that, especially for the COVID vaccine, it will be coming through established channels. We know state and local health departments are going to play an enormous role in what that plan looks like. And, there are messaging campaigns underway right now for folks to understand what that rollout will be. Portions of the plan are being made public. And so I think, really recognizing that it's the commercial supply chain that's helping to move it, but in partnership with government and with state and local health departments. So, there will be secure channels for that. And, would just add that there are also, other groups to sign up for and receive alerts like that. So I know the Healthcare Distribution Alliance has a pharmaceutical cargo security coalition that has a great listserv, for following that kind of information. So there's, things you can sign up for and things you can get smart on now to help, improve your posture.
And I should know more about this. I apologize, but the federal government for a number of years has been working on a drug pedigree program, so that drugs are tracked actually from the point that they're manufactured through the drug distribution channels to the end user, to try to wipe out some of the so-called gray market where things are cross-docked and come from questionable sources. Does anybody know whether the vaccines will be part of this pedigree program or not? I don't know.
And I don't know about the pedigree program, but I know that all of the companies that we've spoken with, they all have some sort of distribution and monitoring plan, whether they be chips or tracking.
Yeah.
And then on top of that, most of the pharma companies that are involved in Operation Warp Speed, and that's all being coordinated in conjunction with the FBI and the U.S. Marshal Service to sort of secure and monitor all of these things as well. It's just, I think Pfizer was the only company that stayed out of Operation Warp Speed, but they definitely have a plan of action going forward, and it will be equally as protected and monitored. It just won't be the federal government doing it.
Great. Thanks, Brian. Another question, Taylor?
I think to sort of counter the risk side of the discussion, it'd be interesting to hear a particular success story or two about catching some of the bad actors. So I wonder if some of the panel has some success stories that they can share about counterfeit being identified and removed from the supply chain, or even prevented.
Or just speaking off the top of my head, we had, I believe it was a pharmacist out of New York that had ordered a ton of 3M masks. And this is more not counterfeit so much as hoarding and price gouging, which was another issue that we had. And he ordered, I don't know, $1 million worth of masks, and then was trying to sell them to the Department of Veteran Affairs and to other state governments, marking them up like 300% per mask. We were able to arrest him. So that's one just off the top of my head.
Yeah, I would say the other thing, watch out for brokers. Brokers often, will promise that they have masks available and can ship them to you, and then will ask for money up front, and they'll disappear. So I would avoid, buying them from brokers. I think in some cases, having people that are on the ground in China is really important. Most of the PPE, including masks, are produced in China. Although 3M has manufacturing here, all of the raw materials for 3M also comes from Asia. So I think it's important to have, quality assurance people that are on the ground that can, visit the factory, sample the masks, understand the quality there. And you might pay a little bit more for a quality inspector to do that. It's well worth it if you're getting a quality product and you're getting it shipped through legitimate channels and so on. So I think having that QA piece up front is absolutely critical. And there are some costs to that, but it's better than ending up with a set of masks that there's no return policy on and you've paid a lot for. So
Good. Taylor, other questions?
So last question on just the balancing of counterfeit risk against the need. So, in a shortage environment, taking time to do due diligence can often mean that you lose out on the opportunity. How do you balance the need for due diligence with the need for speed?
Well, I think due diligence should be the priority. We all would let, during COVID, people ahead of time didn't know. I mean, many states had never bought anything outside the United States, so had no idea how to buy things globally or internationally. Our interviews have revealed that people are a lot better at it now. They understand the issues. But having someone who can work with you on being a little bit better prepared is really important. So I think now that there's been a lot of lessons learned through this experience. Some states have actually set up warehouses, are carrying their own stockpiles. I think there still are shortages of N95 masks throughout the country, and there's shortages on gloves. Nitrile gloves are largely manufactured in Malaysia and Vietnam, and there's shortages of those. So we're starting to see, counterfeits starting to show up. Anytime there's demand that exceeds supply and prices are going up, you're going to see counterfeiters. So just be wary, and due diligence, I think, in this market environment should supersede the need to rush in and buy something where, from a dubious source or an uncertified source, or one that you haven't properly vetted. It's just not worth it. You're going to get burned.
Yeah, no, it's a tough question. I wish there was a short, pithy answer for it, for how to balance those needs. But to kind of echo some of Rob's sentiments, we're 8 months in now, so there are some organizations that can act as a resource. I can share some of them with you, Taylor, after this, to make sure that some of those hubs and those exchanges, those different platforms where vetted vendors are listed, where folks can reach out to. But I think it's a combination of learning more about the resources that are there, and I know federal partners are doing an excellent job of this, is also trying to learn what the real demand is and where the hotspots are, so we can do a better job of forecasting. So try and mitigate against some of those buying behaviors that everyone understandably employs, trying to stock up, trying to quickly have things when maybe you have a little bit more time than you realized.
Yeah, and I'll also say, there's, the global market does respond. So we are starting to see some new kinds of masks come on the market that are even, in one case, there's a mask being developed from a company in Korea, which has better than 95% filtration. It's a different fabric. But I think, if you can't get the N95s, there are other alternatives that are coming on the market that may be worth exploring. So there are people stepping in to try to fill that gap with alternative products that may be as good as or better than what we have currently.
Yeah, and to that point, Rob, there's actually a domestic manufacturer that's come up with a reusable mask with filters that last about 6 weeks. They're certain that they last 6 weeks. They're being tested for a longer life, actually. If you Google, I don't want to put in a real plug for them, but if you Google Canopy masks or Canopy Healthcare, the mask will come up, and it's pre-production, but it's launching very soon, and it provides real protection. And apparently the folks have had a good reception from a number of academic medical centers around the country who find that it's far better and superior to the disposable masks that are out there that we all seem so fond of right now.
I was going to say, like, I would just think that, you know, better safe than sorry as far as vetting up front versus the need for getting goods quickly. I mean, not only if you don't vet well, are you risking potential financial loss, but scarier to me is to not know that you've got something substandard or fake and be utilizing it possibly in a healthcare scenario, something that's not functioning at the level it should. So I think that the vetting is super important.
Yeah.
Well, speaking for a long time supply chain executive in healthcare, I think over the last 40 years or so, healthcare has not really done a good job of vetting the products that they're getting. We've taken the word of big manufacturers and small, the products are safely manufactured and they're what they purport to do and be. And so I think this is a wake-up call for healthcare supply chain in some respects, that more diligence is required around some of these things, particularly high volume items that are used during surges.
Yeah, I think we will see some movement towards building domestic suppliers in this area. It's already happening. And I think that's, you know, part of what we're looking at is maybe not just US suppliers, but you know, potentially, you know, setting up production in places like Mexico. We've even had discussions with, you know, the state of North Carolina to look at, are there ways that we can utilize, you know, some of the empty textile factories that went across to China years ago and to, you know, start to rebuild potentially a domestic textile industry around masks and gowns and other kinds of things. So, you know, I think there's maybe a silver lining here around trying to build up some manufacturing resources in domestically to be able to you know, create national security around healthcare supplies.
Sarah or Brian, any final thoughts?
Oh, just that I think this webinar was well timed, or this series, especially as we're heading into the, like I said, the winter, and a lot of these issues are just coming back to the surface, you know, a little bit stronger than they were before. But as we've been talking about, I think there are a lot of lessons learned from earlier this year, not just lessons learned, but some resources as well. So happy to follow up and make sure that, you know, some of those resources go out to attendees. But want to thank MITRE and the team for pulling this together.
Yeah, thank you for having me today. I was just going to say, for anyone out there in the audience, if you have questions or concerns, you know, never stop yourself from reaching out to your local HSI office or FBI office, or even call us at the National IPR Center. If we don't have an answer for you, we can definitely make the connections or find the answers. We're there to serve the community, serve our businesses, and try and keep everyone safe. So please reach out.
Rob, you get the last word here.
Yeah, no, I think you know, we've all learned a lot as we've said. You know, I think we'll have some additional you know, publications coming out about some of these things going forward. I think you know, with the new administration, there may be a lot of new initiatives also that will be focused on developing a resilient supply base and you know, starting to insource domestically some of the key medical products. So stay tuned. I've seen some of the early bills around that, and so I think there may be some activity that will be going on there as well.
That's great. Good. Well, I'd like to thank our panelists, Sarah, Rob, and Brian, for a terrific job today. Really a lot of great information exchange, and appreciate it. I'd also like to thank MITRE and Taylor for having me act as the moderator today, and I'm going to turn it back to him. I would just point out that if people have been watching the chat, there's a tremendous amount of useful information that people have been posting in that chat box. So I don't know if there's a way to package all that or not, Taylor, but I'll turn it back to you and for final comments.
Thanks, John. I do want to thank everybody for joining us today, and especially want to thank John Strong for moderating, and the panelists, Rob Handfield, Sarah Baker, Brian Weinhaus, for taking their time to share their thoughts with us today. The recording of this webinar will be posted on the COVID-19 Healthcare Coalition website. That's c19hcc.org. So we'll get that up in the next couple of days here. And that recording will include the access to the chat log as well. And I'd welcome everybody to please join us for the next 2 sessions in the series. On December 2nd, we'll be talking about how procurement leaders and their supply chain partners can manage counterfeit risks and identify the tools, resources, and practices to make informed buying decisions. And on December 17th, we'll address how organizations across industry, healthcare systems, federal, state, and local government can work together to reduce counterfeit risks. And information on these webinars will be on the Coalition website as well. So I want to thank everybody for attending. Hope you all have a good rest of your day and a happy Thanksgiving, and please stay safe. Thank you.
Thanks very much.